Hi everyone, welcome. Today we are going to be learning about estimating time of death. So there are three main features of the body that we're going to use to determine this. Remember, the time of death is just an estimate. You can't actually pinpoint the exact time of death, but you can use a lot of different things to estimate the time of death. So after forensic pathology, we'll be learning about estimating time of death. So the first thing you should know is something called livor mortis. Livor mortis is the color of death. So the color of death basically means how, as the body decomposes, the cells start to break down and blood will start to pool and settle on a certain part of the body. The blood cells end up turning like a purplish blue color. The pooling of blood is called lividity. So lividity will start to set in about 2 hours after death, but about 2 to 8 hours after it's present. And if you press the skin, it will disappear. After 8 hours, lividity will stay around the body. Temperature does affect the rate of lividity, so higher temperature will increase the rate or the speed of lividity setting in, and cooler temperatures will decrease. The reason that livor mortis is so important is because of determining position of the body. So of course, in this picture, you can see lividity has set in around this side. So the person was probably laying on that back shoulder area, and that's how the blood started to pool there. So lividity is very important, determining the positioning of the body after death and whether a body has been moved post-mortem. If you see lividity on the top of the body, then obviously you know the body must have been moved after lividity had set in. Algor mortis is the heat of death or the chill of death, we say. So basically we know that the body temperature, human body temperature, 98.6 degrees, you can actually calculate the loss of temperature as the body cools. Eventually the body will cool to match the ambient temperature around the environment. So for example, if my house now is 70 degrees, if death were to happen, the body will cool until it matches that ambient 70 degrees outside. So the algor mortis is the temperature loss of a corpse. There are a lot of things that affect the rate, which are like, are you wearing clothing, the exterior temperature outside. For the first 12 hours, the temperature loss is about 1.4 degrees Fahrenheit per hour. So you can take the temperature to determine how long it has been. After 12 hours, that slows to about 0.7 degrees Fahrenheit per hour. But this calculation can help to determine if we know the timing. Maybe we don't know the timing, but you know the temperature, so you're going to calculate back to figure out the temperature of death. Rigor mortis is the stiffening of death. A lot of people, I think, are more familiar with this one. And so the stiffening of death, basically what happens is normal muscle cells need energy to not just to contract, but you need energy to relax the muscles. So the way our sarcomeres contract is the actin filaments slide in, the muscles contract, and then eventually ATP comes in and rushes in order to relax again. So basically we need the active transport to help the muscle fibers relax. That always requires oxygen, and that oxygen helps give us the ATP energy to help to relax muscles after they've contracted. So the rigidity of death, basically what happens is that the stiffening occurs because those muscles become fixed and they cannot relax anymore, and those cells have run out of ATP. So then there's no active transport ability, so the muscles stay in the contracted position. So within about 2 hours of death, you start to see it starting at the head and neck position. Peak rigor is basically around 12 hours when the body is at the most rigid state. But about 6 hours, you start to see rigidity set in. So 12 hours, the body is at peak rigidity. And then about 15 hours later, the muscles will start to deteriorate because now decomposition is starting. So stiffness will gradually disappear until after close to that 36 hours. You might see the rigor may remain for up to 48 hours, but it depends a little bit on what the person was doing before death as well. So just to recap muscle fibers and contraction, that your skeletal muscle starts off in a relaxed position, the muscles contract, and when they're fully contracted, of course, that's when you have a full contraction and use of that muscle. The muscles eventually will go back to being relaxed once the ATP energy comes in there. So rigidity, what we see is that the body is at the most rigid state, usually within over 2 hours, and less than that, of course, that 48. If you don't see rigor mortis, what probably has happened is the person maybe died more recently, or the person died actually a long time ago and the rigor has gone away. So after the 36 hours, that's usually when the rigor starts to go away. Some factors affecting the rates of rigor will be the ambient temperature, because of course if it's cooler out, it's going to slow it down. Warm will accelerate. If they're wearing clothing or not, sun exposure, and then exercise is a really big one. If the person is exercising or working out prior to death, that speeds up the rate of rigor. And then body weight, of course, can also accelerate or slow this down, the effects. The last one we'll talk about today will be the stomach and intestinal contents. This one is sort of a side note. This isn't necessarily to help determine necessarily the time of death, but it is going to help you to determine what the person was doing before they died. So in the stomach and intestinal contents, what we know is that if there's undigested stomach contents, then the last meal was about 0 to 2 hours before they died. If the stomach is empty, but the food is found in the small intestine, then we know the death occurred about 4 to 6 hours after the last meal. If the small intestines are empty, but it's now in the large intestine, we know it was 12 or more hours since last meal. The reason this comes up I would say in a lot of cases, what ends up happening is this is helping to determine or corroborate, say, an alibi. So for example, if somebody's wife dies and they say, well, we were out to dinner, we had pizza, we had drinks, we were out, and then, I brought her home, and then, they never saw her again. That story can either help, sometimes people don't realize, but stomach contents are really important. So if you say you're out to dinner with someone and you had pizza, it's very easy to tell if the person was lying or not, because you can digest, you can internally inspect what's going on in the stomach. You can also tell how long it's been there. So there are many situations where someone was trying to tell a story saying they never saw the people again, or they dropped them off, or whatever happened. But if you find that maybe it's been 4 hours since they've eaten, then you know that something had happened at that time. They didn't die right after dinner. They actually died 4 hours after dinner. So stomach contents and intestinal contents will be really interesting. There's a few case studies that we will look at that have to do with the stomach and digestive system. So at this point, we're going to stop there. There is a time of death chart that you will be using to investigate some of these case studies. So at this time, you can go ahead to the time of death chart and use that to help you through these cases. And then we keep coming back to these concepts as we keep going through the unit. So I hope you learned something new, and I'll see you next time.